My name is Joanne McEwan. I'm a health visitor in Oxford, and I work for Oxford Health NHS Foundation Trust. I'm going to speak about an award that I received in October 2015. It's the Mary Seacole Award, which is given to nurses, health visitors and midwives who have a project which benefits the Black minority ethnic community. The project I have here in front of you is a project called Let's Talk FGM. And this project was to produce an app to help enable health professionals and clients have a discussion about FGM or female genital mutilation. From this discussion, it would help the professional be able to identify girls at risk of FGM and at the same time provide support to women who have survived FGM. I think we'd all agree that discussing FGM is a difficult subject to talk about, and as health visitors we sometimes find ourselves in someone's living room or kitchen knowing our clients for the very first time but not knowing very much about them. We don't know their past medical history, we don't know their country of origin, we don't know what their home language is. And we know yet that we are responsible and we have a duty to care for girls who may be at risk of FGM and women who have experienced it. So with that said, this project was to help support professionals in this process. There are some recent studies that have been done over the past 10 years which have highlighted that professionals or health professionals lack confidence in discussing FGM and also lack some knowledge as well. So with this process of having an app in practice, this hopefully will help give professionals a bit more confidence and be confident in their knowledge, but at the same time help the discussions with the clients to be more comfortable. So in practice, we have iPads in Oxford Health. Other places in the UK, you may have Android tablets. Some places are using laptops and so on, or smartphones. But as community mobile workers and in public health nursing, more and more we're using technology to help us have discussions with clients. And so designing this app was to help make that job a little bit easier. So what is this project about and how was the app made? So it started off by trying to understand what the users of the app really need to be in the app, what we want to discuss, what sort of barriers there are to discussing FGM. So I set up focus groups. There were 3 in total and 1 in-depth discussion with a FGM survivor who was a service user. The first focus group were with professionals. They were mainly health professionals and some social workers. The second focus group were from a local charity called Oxford Against Cutting, which has women who have survived FGM working with them, or women who come from FGM-affected communities, and also women who work with the charity. The third focus group was with 6 formers from a local secondary school, and the girls in this focus group were all from Black minority ethnic communities. So from the focus groups, we understood that what the women wanted was to have a tool which is collaborative, a tool which has audio and video messages, that it would take into consideration the different languages that the women use. There could be languages, their home country languages, that the images and the expressions in the language used should be culturally appropriate and positive images, and also that the points were easy to read information. So from these messages, this was collated together in order to form the content of the app. And this process was done with a digital agency whereby all the information was collected and a wireframing exercise was put together where we looked at possible scenarios of how the app might look. It also looked into the health visitor's day. What does a health visitor do? How do they make an appointment with a client? How would they how would they raise this question? How would they go back to the house and so on? So it was about understanding the fine detail. And with that, they were able to come up with a process and a design for the app. Also forming that, there was a lot of recordings. So there were audio recordings of women's voices in their home country language. There were films made. And so all this formed a component of the app as it is today, which is called Let's Talk FGM. So once the app was ready, it had to go on something called beta testing, and it was put on a platform called Test Flight. And this allowed people to have access to the app, install it on their iPad, and then be able to test it on themselves, use it with their clients, and so on. The app was sent out as an email to health professionals across Oxford Health, including another hospital trust within Oxford, including social workers and, again, the community charity Oxford Against Cutting. And this was trialled in two ways. It was used in practice with clients, but it was also used in workshops with the community charity Oxford Against Cutting. And so from that, I gathered feedback from online surveys as well as attending the workshops and also paper questionnaires as well. The feedback from the youth was overwhelmingly positive. 100% said that they would recommend the app to be used by others, and they see that it's a positive tool. What did come out of the results was that the app was beneficial not just to health professionals, but the women working in the community wanted it to be available to the public. They wanted to be able to talk about FGM with their own families. And so in evaluating all this feedback, what we decided to do was to have the app launched from the App Store and available to the public. Now the app is version 1 at this minute, and so all the feedback that we garnered from the questionnaires still has to be adapted in a newer version. But at this minute, version 1 is available to the public on the App Store. So what's on the app? There are key facts there. So it asks what is FGM, and it gives a very basic diagram of different types of FGM. It also asks questions like, well, why does it happen? And as you scroll through the app, you're able to see different reasons as to why it may happen according to different cultures. Some of the women or men who read this with you may identify with some of the reasons and may not identify with some of them. It also discusses the health effects as well. And it also asks questions about, well, what would you do in order to protect your own child? What's the human rights aspect of FGM? What does religion say about FGM? And it also suggests local support within Oxfordshire for women who need psychosexual counselling or need to attend the local Oxford Rose Clinic. There are also videos. These were made with young people, young students. We have a video of the Oxford Rose Clinic, the director kind of walking the client or the patient through an appointment and letting her know what would happen when she attends. There's also a video of a Muslim scholar who discusses that FGM isn't something Islamic, and this was something that came out of the focus groups. The women wanted that to be made very clear, so that when they talk to others, they've got someone who has some kind of knowledge and authority to say that this is not an Islamic practice. We also have a video of 2 women survivors of FGM who discuss how they believe that it's important to protect other children from FGM. And then we have 3 young women who originate from FGM affected countries and talk about how it's ended in their generation and how it kind of gives a kind of positive message. All in all the videos are positive, maybe a bit moving, but in general it gives a positive light to the subject. In the soundbite section, there are 6 countries that are mentioned, and this was all about sharing culture with with our clients and patients. So saying to them, well, you come from Kenya, I know a little bit about Kenya, and let's go through some of the information that we have. And if the woman can't speak English very well, or if she prefers to hear this information in her home language, then this information, which is in text in English, is actually pre-recorded in Swahili for Kenya. And as I say, there are 6 countries with the different languages. So Let's Talk FGM is an app to support professionals and clients discuss a difficult subject. It's in its first version right now. It's available on the App Store to be downloaded and installed onto the iPad. My plans are to have a version which is available on Android version tablets or other smartphones and iPhones. This involves, raising more funds because the technology is costly. We also want to add more videos on the iPad on Let's Talk FGM. At the moment, there are plans to do a video on men's voices or men speak up and their attitudes towards FGM, and that again will be with the local charity Oxford Against Cutting. So I hope you are able to install it on the iPad. If you don't have an iPad, I do hope in the future that we'll be able to have an Android version. Please do use it with your clients. You can use it for your own self-knowledge to remind you, but it's also very good as a training tool as well. It was very positively received by the local mobile workshops that Oxford Against Cutting used to help give a structure in discussing FGM. Thank you.